Welcome back to Uncharted Narratives. Today I'm joined by Rachel Taylor, who went from the bedside to the classroom because she saw how much international nurses need real support to thrive. Rachel gets it. She knows the hardest journeys lead to the best outcomes, and that nursing is not just at the bedside. In our conversation, we dive deep into the cultural shocks, language barriers, and critical thinking gaps international nurses face. Plus, how mentorship and smarter education can change everything. Rachel's passion for preparing nurses for reality, whether they're coming from abroad or right down the street, is so inspiring. If you've ever wondered how we better support our global nursing workforce, this episode's for you. Let's jump in.
Hi Rachel, how's it going?
It is going great. How's it going for you?
It's going super good. Every time when I arrange for any episode, I am the one who are chasing and connecting with other because they have different plan and they keep changes. This time it's happening from my side. I keep changes this, and thank you for your flexibility and having you today to share your experience. So I am happy for today. What about you?
Yeah, I'm looking forward to it. Anytime I can talk about nursing education, it is definitely something I look forward to.
I believe now we have a lot of news outside we can discuss today. But overall, before we get into our discussion, give me a sneak peek who you are, what you are doing.
Yeah. So my name is Rachel Taylor. I started off in the ICU and then I actually worked with veterans for a little while. But during that time, I really developed clinical judgment, really focused a lot on patient advocacy. I started mentoring new nurses, precepting them. And then I got offered an education role where I was an NCLEX coach and really just fell in love with nursing education and every aspect of it. And then I joined Archer, and really why I joined there was to scale impact and to support nurses worldwide. At a college, you have a small impact of just these few students that you're working with, which is super important and super glad that was part of my journey. But now I've gotten to work with, we've had 850,000 nurses use our program. And so it's just a much larger impact, which feels very rewarding.
Yeah, it is a lovely story, and I like it. You see the value you can add it out of the bedside, and the impact will be wider than what you used to do it in the ICU. I came from the ICU, and I know how it's hectic. But being had that mindset, you can deliver something out the bedside like what you did. This is something amazing, and see some people like you. They want to support wider persona or people. So take me through this. I believe you touch base with that, but I want to get more deep. What is the motivate you or drive you to leave the bedside and to move forward and start working on education system?
Yeah, so I have a few things. Number one, I had some faculty when I was a nursing student that were not helpful. And that was kind of my first insight of wow, why do people choose to educate if they don't love being an educator? And so that was my first, I think I want to do this one day, but to be totally honest, I thought I was going to be 60 years old when I started being an educator instead of I started in my 20s. And so I think we sometimes almost delay what we're meant to do because we think we're too young or we're not ready yet or we need more experience. But that was my first one of just seeing so many students struggle because they didn't have the right faculty support that they needed, but yet the blame kind of was put on the student. And I really struggle with that. If we aren't giving students every chance to be successful, then that's on us as educators. That doesn't fall on the student. And I saw a lot of students who just could not connect the dots, especially when I was precepting, between the knowledge they had and actually applying it. They were really stuck in the textbook. I learned this in the textbook, but they couldn't apply that. And I think we saw that a lot during COVID when we had brand new nurses entering the bedside, but yet they didn't get the full clinical experience because of COVID, because they weren't able to. And I feel like they weren't supported as well through the educational experience. And there was a major gap here. And then I felt really, really called to just reduce the barriers for international first generation nursing students. What I find time and time again as an educator is when I put in the effort to support them, where they feel encouraged to feel like someone has their back, they go on to be successful and do amazing things. It's when these students don't feel that support, that they don't feel like anyone has their back, that they seem to just struggle significantly more. And so we can reduce that by putting effort and time and energy into these students. And I think they just need more time and effort from us as faculty and from those that are experienced nurses.
Wow, super deep. I
I
believe
just unpacked a lot. I'm sorry.
no, I believe I we can stop here and forget everything because you touch a lot of very critical issue here. It's resonate with me and reflected here a couple of the things. It's like you remind me with my story. I never thought about it. So one question, not one question. One thing here, I hear it immediately. You thought to be on the education or to be educator, you need to be with the gray hair at 60.
Oh
And
yeah, for sure.
yeah,
I thought I'd have full gray hair before I was an educator.
still too young to have this, but why we have that concept? I'm not ready. I'm not enough. I need uh, uh, to have this X number of age in order to be on that system. And I believe this is right. This is everywhere. Now, just to highlight it, Rachel, you are in the US, right?
Yes,
Yeah.
yes, in the
In
US.
which state?
I live in South Dakota, but I will say because of my husband's job, we move a lot. But I've always been in the Midwest. So I grew
Where
up
you
in
study?
Minnesota. I went to nursing school in Missouri, first became an educator in Missouri. I then moved to South Dakota. So kind of always been in the Midwest.
Oh, Missouri. I have my family. They are in Missouri. So this is St.
Really?
Louis. They are in St. Louis. Okay. So tell me about what from your perspective right now. We become we growing right now, and we have more a mature perspective, especially when you start working with that. Right now, why we still till now 2025 we think this is the right recipe to be educator.
I think there's a few things. So number one, when I think of the educators I had, they were all older. But two, it's what you hear all of the time, right? And so when I was a nursing student, they always said you have to start in med surge. You can't start in a specialty unit. You have to start in med surge. Well, that's not how we do things anymore. You can start in whatever specialty you want to if you put in the work and you have an expertise there. But it was kind of the same thing with education. It was like, well, you need to have years and years of experience to be an educator. But what we look at so much is what letters we have behind our name instead of, hey, are they passionate about education? Are they a good educator? What's their ability to educate here? Or I think we focus so much about did they get the degree and less about what's the quality that they're bringing to our students. And I think we have to shift that perspective. And it does take time to get those degrees, right? Like I have my master's in nursing education and I just got it. I just happened to get into education without having that. But most of the time, specifically in the US, you have to have a master's in nursing education to sit in a role like I do, or even further, like a doctorate. But I think sometimes we care too much about, again, those letters behind the name instead of what value does this individual contribute to the nursing education space. I think
So
we're underutilizing
I
nursing.
don't want to put word in your mouth, but what I understand from you, we are chasing those letter after my name, not for sake because I like education. This is the social status which I want to have it. This is how I hear it.
Yeah, I think at times it can be that. And I'm not saying people with their DNP can't be amazing educators. I know so many at every level that are incredible educators, but I think we miss some of those great educators because they might not have that specific degree that we're looking for. And there's probably a space for them in education, and we're missing that opportunity for them because they don't have necessarily the degree that pairs with it. And I do think for some it is very much that. And I get it because the day I graduated with my master's, I literally started Googling nursing doctorate programs for education. So, like, we do that. We always want more. I think, especially, I don't know if this is specific to the US, but we're always after the next goal. Like, if I achieve a goal today, well, what's the next goal I have? I can't ever just sit and, wow, like I've come this far. I want the next goal. And I think that's more of a cultural thing here. Like, we are very fast paced. And so I think part of it is because of that, of just the cultural aspect around kind of always wanting more.
I believe we will get more deep about the US and US market education. And the reason behind that, now we are shooting on which day? Today it is November 24, where the big bill, what you have it here, or beautiful big bill. It is the trend right now, and de-evaluate the nursing profession. This is something I believe it's good to touch base with that and see different perspective, and this is will give us more opportunity to see the trends and the mindset beyond the American and the culture they have. But let's move a little bit more about your experience and you when you decided to be an educator or within the education system or the one who support the nurses to pursue their career, you move to international education nurses and start to help them to prepare them to be NCLEX prepared and help them to pass this exam. So why in that time as Rachel not fixing on the US market? Why you thought let's move or what is the drive you to go for the international student?
Yeah, so number one, there are a ton of students that seek to go to other countries like the US, like Canada, for a better life. I've worked with so many that I've been on a Zoom call with them, and they're like, I'm so sorry, I have to have all the lights off because I can't afford to be on this call and have my lights on at the same time. Or where there's buckets in the background because water is dripping through their roof. And it hurts my heart a little bit because what they're seeking is just more opportunity. They just want to be able to go somewhere where they have more opportunity. And if I can support them in that so they can reach their goals, I want to do that. The other thing is in the US, we have a major nursing shortage. We also have a lot of nurses that leave the bedside pretty quickly, which isn't helping the nursing shortage at all. And so, what I think we can do is we can bring in international nurses who, one, are seeking this better life, but two, that can also help our nursing shortage and bring those two dreams together to help those international nurses, but also our infrastructure here in the US with the health care that we need, the nurses that we need. And what I'll say is the international nurses, when they've been working as a nurse internationally, they work really hard. Like they have some of the strongest work ethics I have ever seen. They're a lot of times more adaptable. They've had to have a ton of clinical experience just to even take the NCLEX. And so they have built this high resilience because of different life challenges that they have maybe had. And I think it really shows that there's a lot of opportunity for international nurses, whether they choose the US, Canada, some go to Australia. I'm sure others choose other countries as well, but those are the ones that I kind of hear the most often. I think there's a lot of opportunity for us to support them, and it helps both parties.
You touched my heart when you mentioned the story about the light and dripping water in the back or in the background. So I came from consider is not wealthy family, so I went through the intermediate class family, and I can understand the poor people or poverty how that it's very difficult for them. And I try right now not to put myself in their side because my character I'm stubborn. Nothing can stop me anything. So I don't pay rules and structure sometime until I reach my goals. Again, all of those legally and ethically, but nothing can stop me. But from your experience, is this to come from poor country or from poverty impact their chances as their education is not the standard you have used in the US? Is this is something
I think there is a difference in scope. So, and it depends on what country they're coming from. So, for example, individuals from the Philippines, their education system is really close to what we use in the US and Canada. So, it's a lot easier for them to transition. Then you have individuals who come from countries like Mexico, and the scope of practice looks significantly different. And it's a lot harder for them to pass the NCLEX because there is such a different scope of practice, but also what they're able to do on their own, right? In the US, there's quite a bit as an RN I can do on my own. In other countries like Mexico, they have a physician that they're calling more often. The scope of practice looks different. And so I do think individuals that maybe come from, yes, maybe a poor economical situation, or those that just don't have nursing systems that look the same as the US or Canada, are going to face more challenges because they haven't adjusted to what critical thinking and clinical judgment look like. The other thing is it's not cheap to get to the US. A lot of people are not doing that on their own. They typically are working through some type of agency in order to go from another country into the US into Canada. There's several of them that I have had experience working with as an educator, and they kind of help that transitional period. But why so many students are after it is I've had a student tell me what they would make in a whole year in their country would equate to what they would make in maybe 2 weeks to a month in the US. And so, and that's with them working 6 days a week, maybe 12-hour days every single day. And here in the US, you're typically working 12s unless you're picking up extra shifts, and then you're paid extra for that. And from what I've heard from international students, they're not always even paid for that extra time that they're putting in, depending on where they're coming from. And so I think they really view coming to the US or Canada or those other countries is like this opportunity of, one, I'm paid for my skill set that I have. So they may come from this poor, you know, country or background, and they're able to make it to where now they actually have, a strong standard of living. And I think a lot of people are after that. When I talk to international nurses, finances is one of their big reasons. A lot of times their whole family is supported off that one income. And so it's not just for them, it's for their entire, family, their kids, their spouse. And sometimes it's parents end up coming with them. And I think there's a lot to unpack there.
Absolutely. So, from your experience working with the different culture, background, and country, what is the common strength overall
Mhm.
they have as international nurses, educated nurses? They will enrich the US workforce from your perspective, from your point of view.
If I were to think of my top one, I would say work ethic. I think international nurses, because they've had more challenges they have to overcome to get to the US when they get here, their work ethic is so strong because they truly want to be at that table. They truly want a seat in the nursing profession. Not that
Mm,
nurses in the US don't, but we, from my own thoughts on this, I haven't had to face the challenges international nurses have had to face. And because they've overcome them, they really have a lot, and how do I want to word this? They have a lot more resilience than I think I could ever have, because they've overcome challenges that I could never even imagine overcoming at times. And I think it makes them more resilient for that.
absolutely, I agree with you. So, if you want to put your standard, your own benchmark,
Mhm.
I can see the best country you work with them or nation, the Filipino. They are the best in the nursing. Is this is right?
If I want to say a best or a worst, but I would say their education system is the closest, and they tend to be more successful when it comes to passing the NCLEX the first time. I've worked with a lot of international nurses in the hospital. They were very, quick with skill sets because it was so similar. So I don't want to say that they're the best, but I would say they are the most similar to how education is structured in the US.
Okay, I don't want the similar. Because of that, do you consider the US it is the best nursing system worldwide or Filipino?
I think this is a tricky question to answer. I think if I were to look at it, right, I would say Canada, Australia, the
Don't
US
be
are very
politics.
similar.
I am
But
asking.
if I have to pick one,
Uh,
oh, this is hard, right? Because I don't know the ins and outs of how every person
yeah, this is
ever
based on your
educated.
experience, based on your
If
knowledge.
I were to have a nurse working in the US, I would want a US trained nurse, if possible, in the fact that the education system is going to match the needs of that healthcare environment. And I think that's with any country, right? Like if I were to look at Mexico, they're training their nurses for what the scope of practice for nurses in Mexico. They're not training their nurses for what the US scope of practice is. Why would they do that? And so if I were to say, it's really matching what country they're going to work at with that education. So if I'm hiring for a nurse in the US, they will probably have the best chance of success if they were US educated for most parts. But yes, my international nurse educated, I would say the Philippines would be the closest and best able to transition into the US. Did that answer your question? I know you want the hot topic here.
I work with the Filipino. In Jordan also, we have a lot of Filipino. We have issue in Jordan. When I start my career as a practice as a registered nurse in the ICU, we have shortage in female nurses. And
Mm.
we have more male than female in the workforce, which make imbalance there. So we bring the Filipino, and I have worked with them. They are brilliant. So I can tell. I can tell how they are very supportive and educated, and also I learn from them a lot. And even sometimes I am more senior than them, seniority than them, but they are a lot. So I have nothing to do with the Filipino, but to try to understand if I am international student, what is the standard and criteria they use in order to do that. Okay. Now my question for you, you keep mentioning Canada, Canada. If I am international nurses and I want to immigrate, what is will decided for me to go for US and can or Canada based on your experience?
So a lot of times agencies, depending on which agency you work with, will give you that option. And a lot of agencies will only work certain areas. So some agencies only work from, let's say, Mexico to the US or Africa to the US or the Philippines to the US. But others, they give you choices. So there's one in particular that comes to my mind. They actually help nurses go to Germany. They help nurses go to the US, to Canada, and to Australia. I believe I named all of them. And it's up to that nurse, like, where do they want to go? Now the requirements might look different. Why the US and Canada and Australia are so similar is those three are the ones that require the NCLEX. So the other countries are not going to require the NCLEX. The NCLEX is a national exam, but it's used in Canada, in the US, and in Australia. And so that's where that benchmark kind of comes of, like, that requirement is similar for those countries to be able to practice there. And so a lot of times when individuals are thinking about, what agency do I want to go through? What country do I want to go? It's really asking them to do some research of what they want for their life, right? Some individuals are going to choose Canada over the US because of political climate. That looks very different. Some people are going to choose it based off they have family that lives in one or the other that they want to be by. Others base it off of a dream that they have of what they want to accomplish with their careers. And I think that looks different for everybody of which country is best for them, their life, and their family that they have at the time. Some people seek the US because there's specific universities they want their kids to go to one day, and their kids really want to go to this university, and they know that. So they try to move their whole family over early to get ready for university. And so I think there is kind of a different answer for everyone. Did that answer your
It's fair. Yeah, it's fair. It's there is no one pathway for everyone and depend on your personal direction and preferences. But the main reason from this equation, do you agree that the get into the US market for the international it's has faster pathway compared with Canada?
I think it can be depending on without getting into politics too much, but political climate a little bit, right? So, for example, I know individuals that have recently gone to Canada and are seeking residency there. And if you have a job there, it gets a lot easier, but it's really, really competitive to get residency in Canada. In the US, it may be easier initially, but then there might be roadblocks that they hit later on. And so I really think either isn't going to be easy. I think either is going to be challenging, but if someone truly wants that, then it's worth the challenge. It's kind of anything in life. Like, it might be hard to achieve a goal, but at the end of the day, it's going to be worth it when you get there.
Okay, so yeah, that's fair enough. So what you is let's put it in this. Are there specific culture or education gaps international nurses commonly they faces when they transition to the US?
I think the biggest one is going to be the language. If they didn't learn English very early on, learned it later, or if they learned a different version. So, what I mean by a different version is you've maybe learned English of how it is in a textbook, but how I speak might sound significantly different than how someone learned it in a textbook. Or it could be, that somebody doesn't understand one word and they go, for example, for the NCLEX, this is a common challenge I see is it's like that one word is different than the word they know it. So they're having to look up words a lot. Or when we get to practice, you might have a doctor giving you orders and they're talking kind of fast. And you're like, I'm not processing at that same speed. Now, others internationally, they are great. They know English like the back of their hand, know it as well as I do. And that's the only language I know, right? But there are others that it is a significant challenge for them, a significant struggle, and it just doesn't come as naturally. So I would say that's one of the bigger barriers that they have. But I think something that they do bring is they strengthen that cultural competence. So something that students look for, something that patients look for, is to see themselves and the nurses that are caring for them. We like the US is the melting pot, right? When you think about it, there are people from pretty much every country out there in the US. And so if they never see someone that is an international nurse, they never see someone that comes from diversity, it's going to be a lot harder for them to be cared for adequately in that scenario. And so I think it's important that we bring in these different cultural perspectives because it strengthens our team overall.
Yeah, and thank you to bring the language here. And I want to share my experience. English is not my first language, and I used to use English since I was in the school. So we studied in the school in English, and I work in my home in English. And whenever I go for, I'm working in English. But when I moved to international company, I had the experience to manage a meeting. I am the facilitator, but not my guests, my colleague who are working and they came for the project which I work, and I need to manage the whole conversation. One from US, one from Canada, one from Australia, and one from UK. And I am the only one who is not native speaker. So I was very nervous at that time how I can manage this discussion with them, for accent, for different style, and the ages is different. Some of them very old, some of them my age, some of them they are friendly, some of them they are not. Different hierarchy structure, and yeah, it's a lot of pressure. But surprisingly, in the middle of the call, I keep hearing from them the four, stop, stop. What you mean with this? I didn't understand. Can you repeat it? What that meant? So four of them they are speak English, but none of them they understand what they talk about. So that give me the confidence. Sometimes it's not about how you speak English, or you speak English, how they speak English. So they are native speaker, but they have different way of using idioms. Sometimes it's not matching, and they thought it's easy. Accent, it's a little bit confusing, especially when you are working with someone from UK or from Irish. So we thought as international, no, I can speak English. This is not an issue. No, it is issue, especially when you work with the patient. They are senior or
Yeah, they're hard of hearing and they're like, I can't understand you. And you're like, I'm trying so hard. And they're like, I still can't understand you. And that gets challenging. I think there's like these small things that add up that make it more challenging for an international nurse. Like even thinking about the difference in the US, we use patient centered care models, but a lot of other cultures, they use physician driven hierarchies. And so that can be hard. The other thing is like legal aspects. Legally, what you can do in a nurse as a nurse in one country compared to another looks vastly different. And so you really have to know scope of practice. Even in the US, every state that you live in has a different scope of practice. So I'm in South Dakota now. My scope of practice is different than when I lived in Minnesota and when I lived in Missouri. And so I have to know my scope of practice and how that changes depending on the state I'm in, or I could do something that isn't legal. And so there's a lot that kind of comes down to the US. You can't just go to one state and assume same scope.
sounds good. So let's move more now into the education. When you start taking about your passion and your driver was because your experience in the school and where they use outdated technique in that time. So let's focus in this area based on your experience and based working on X year of experience now in the market and see the good and bad experience internationally. Let's focus now from your perspective without focusing in which country. Okay, what you think or believe best job in order to prepare nursing when they are in the school to be market fit or market ready?
Yeah, so schools have to focus critical thinking, clinical judgment, do a lot of simulation, and be evidence based. If they are not meeting those things, then they are not going to be a strong school to really go to. Because if you're not, number one, if you're not evidence based, you're not doing what's best for your patients. And so schools that aren't keeping up to date or a red flag kind of from the get-go. And I think the thing that even, no matter what country you're coming from, that is a challenge, is that critical thinking aspect that comes in as a nurse of my patient is coding right now. I do not have a doc at bedside yet. Obviously, I'm going to get one, but what do I need to do? Or, hey, this patient's coding, but I also have this patient on a drip over here. I've got this patient who's getting a blood transfusion. I have to focus on this code, but how am I going to delegate care out to these other patients so that their needs are met because they still have very acute needs? And obviously that's coming from my ICU brain of I've had really critical patients and things that happen all at the same time. And you have to have that critical thinking, but that's going to come with any unit, even on a med surg unit. When we think of ratios here in the US, you typically have 6 patients. And so you have to understand, how am I going to critically think through each of these cases and apply clinical judgment to know what to do, when to do it, to have strong time management. Because if you don't have that, your shift's not going to go very well, but the work's not going to get done. Ultimately, the patient's going to suffer. So those would be my big things of ensuring schools include aspects of that kind of throughout their programs.
Okay, that's good enough. Yeah, I agree with you. However, most of cliche response coming right now about AI and technology. This is something is good, but you focus more not only in the technical,
So
also in the soft skills like evidence based and sorry, the clinical judgment. Those some things it's very hard to learn in the school. You need space where you need to learn this. So go ahead.
yeah, AI is huge. Like, I definitely think AI can bring a huge benefit, but it is not to ever replace an educator. The aspect that AI will never have that we do is human connection. That is what makes us uniquely human in my mind, is that we are able to have connection. I'm able to tell emotion. I'm able to respond appropriately to emotion. Will AI maybe get to the point that it has abilities to do so? Sure. But it's not an authentic, connection between two people when you're including AI. So I think AI has a big aspect where it can help. It has a big risk that comes with it, though, at the same time. If AI is not guided by an educator, research shows that it actually declines students' ability to critically think. And so when it's educator guided, though, it can actually push a student to understand more, to get more done, to actually push them further in their education. And so what we have to be cautious of is how students are using AI, how we as educators are using AI, to make sure that we're using it in a way that is pushing us past where we're currently at, not harming us and just doing the work for us, right? I got my master's in nursing education over the last several years. I graduated this summer, and I had instructors that were very for AI, and I had instructors that said, if you use AI, you're failing this class. It was a very mixed. And what I found was I would use AI to help me become better, show me my gaps. Where am I not strong enough in my writing? Where did I need to have more points because it wasn't clear to the reader? Maybe I was writing on diagnoses. Hey, what other tests should have I ran in this case? Like, these were the ones I thought I should run, but should have I run these other ones with pathophys, really going through these disease process of like, hey, I caught the client had these problems, but what else did I miss here? And so AI strengthened my ability to study in that way. But if I just said, hey, what's the answer to this? Then my thinking has gone down instead of up. So I think AI comes with great benefit and great risk, and it all depends on how it's utilized.
Absolutely. So here you can see the AI will be it's like a tool, like when they invented the calculator. Still, I need to use my brain. The calculator will help me to save some time, but I need to build my mental capacity and my skills in order to use them in the right way. So when I meant from here, also, most of the time, for non-technical people, when they are in education, they thought this is the trendy. Let's go with the AI, and this is the AI. Something is nothing new. It is very old. So our US nurses or American nurses or Western nurses overall, which we see them as a role model for the other country, when they are graduated, ready to use the hospital system and technology, so can they go and make charting in on the EMR? They can use PCMR. Can they send email probably with the proper language and tune? However, they are native speaker in English. that can they communicate probably with the patient and give them passion, empathy, and sympathy, and help them to find all of those. Do you think our system right now prepare our student to know and be ready to start their job immediately from the first day?
I think it's hard. So when we think about the NCLEX and being practice ready, we're thinking, are they ready for what they would see in their first year as a nurse is really what we look at is, have we prepared them for the first year? Thinking on my own journey, there are some things I don't know that you can ever prepare for. It's like when it happens, you have to be ready for it and do the best you can. And I do think in nursing, everything is a learning opportunity. There are so many experiences that I had as a bedside nurse that helped me grow and learn that I don't know that school could have necessarily replicated. I do think we work a lot more now than we used to on bedside manner. How do you communicate with patients? What notes do you take? How do you take them? Knowing that a patient can look at anything that you chart, you need to be thoughtful of how you are wording things, right? Like I need to be intentional because they're going to read that. And I want to make sure that I'm okay with how I'm communicating if they were to read it. If I were to think of AI, it can help me, hey, add this to have a softer tone. Help me to understand someone else's perspective in this email so it's not coming across as I'm blaming or that I'm accusing. So I do think AI can help us in the email communication aspect that you're talking about, but it can't help me when I'm having a conversation directly with you. It can't tell me what to say as I'm saying it. And so I think there's this mix here. A big way that AI is being used, not by nurses yet, but by physicians. And I have a feeling it's going to be used by nurses eventually, because there's actually an app that goes on their phone that they will put typically in like their pocket up here that would record a conversation that I would have with my physician, and it would automatically document that patient visit. And it saves them charting time for physicians. I have yet to see nurses use it, but physicians, it has become a really big thing over the last year. More and more are using it. Anytime I go to the doctor, it seems like, oh, wow, another practice has initiated this. So I do think there's opportunity for nurses to where some of the tasks that we have that take a lot of time but don't provide a ton of value could become quicker using AI so that we get actually more face-to-face time with our patients so we can build more rapport, so that we can have better bedside rapport. Because what I think happens is it's so fast paced right now. We have so much to do in a 12-hour shift and so little time. And typically nurses are overworked and overloaded. And what happens is we forget what truly matters at the end of this is the patient at times. And we get so caught up in our charting and the tasks we have to do that we don't always build as strong of rapport as I think we would if we didn't have all these tasks on the side. And I think AI is actually our answer so that we're getting more face-to-face time with our patients, because that's ultimately what builds trust with them, is us communicating face-to-face.
Do you think or believe preparing our nurse to be market ready or market fit will help decrease the turnover? This is can come not only from the hospital, from university, because
Yeah.
in university when we learn them in the optimal case scenario, an optimal situation, but this is not the reality when they are graduated. So do you think this is something university they can take this in order to improve their education system or way of train them?
I think there's some schools that really do a great job. I think there's some that need improvement. If I were to look overall of what we hear often, especially since the pandemic, is that nurses are not always bedside ready to the level a hospital would want them at. But when I think about this intentionally, I think there's two things that come together here. Number one, student desire, right? Like, are they just check boxing everything off and saying, hey, I got it done, I'm ready to move on. But two, we should never graduate a nurse if they're not practice ready. They should never have graduated nursing school if they are not ready for practice. And that's with support in practice. And I think this is actually where our problem maybe is more than anything, is that a lot of our experienced nurses are not staying at the bedside. They're doing other things with their careers. They're not at the bedside. So sometimes your most experienced nurse on a unit has 2 years of nursing experience, which isn't a ton. And so I think we run into what was practice ready before and what is practice ready now looks slightly different because the support that's there once they're in the units is different than it used to be. And so My grandma is a nurse, and she said it was very much like I learned on the go. I learned trial by fire. It was not like, oh, let's calmly do this. It was like sometimes she just had to learn in an emergency situation. And she very much had the experience of nurses eat their young. Like the nurses that trained her were not always nice to her, but she came back with it was the best thing I needed at the time. And I think we have shifted, right? We're trying to be more supportive, we're trying to be more encouraging, but I think sometimes they're not getting this opportunity with an experienced nurse next to them where they feel safe going through all the situations. And I think that's what's making nurses not as practice ready as they used to be.
I believe the school or university cannot make them 100% fit at all.
Yeah, there's no way.
No way. And they cannot teach them in everything. There is a personal experience and everyone they will take it.
Mhm.
But I start to have that feeling, especially with the student I work with them and parts from the coaching. There is a transition shock. The way how they train, it's extremely different from with the reality. Like you are in the calm mood, then you go for chaos. This is totally too different. So I believe there is something in between. They need to be adopted. It's good to let them know how to work under pressure, how to manage their emotional, because
Yeah.
this is very hard. Yeah.
This is where nurse residency and mentorship come in. So, a lot of our big healthcare systems in the US have a nurse residency program they put students through. Great results with strong nurse residency programs, as well as mentorship. Like, this is where you find that experienced nurse to mentor you. Because, yes, I should take back what I said earlier in that, if they're not practice ready, they shouldn't graduate, but they should be most of the way there. I don't expect it to ever be 100%. But if like there's a concern that they can't practice when they get there, we should work with them more before we transition. I think the biggest thing in the US that we do that helps people be ready for that transition to practice is our capstone course. So I had to do hundreds of hours of clinical, and I went in the ICU for those 100 hours, several hundred hours. It wasn't just 100, but I was in the ICU for those. I got to be the nurse. I had a nurse backup, but I was running the full patient load during that time. I was able to do an internship the summer before where I did the same thing. And so I think it's making sure, like, does every student get the opportunity to get a capstone in a high intense work environment that teaches them how do I figure out time management? How do I have that resilience? How do I figure out what to do when things are really, really stressful so that I am emotionally intelligent in these situations? I think we need to help ensure, hey, are all students getting these opportunities?
And it skipped to my mind for the first time, to be honest. I never thought about it. I don't know if this is something makes sense or not or valid. So in the business or any other industries, not in the medical area, where the company they came and work with the university to make sure the outcome from the university will help their business in the future. So there is sort of partnership, and sometimes especially in the third or fourth years when they are senior they visit them and sometimes acquire them immediately. We don't see this is in the medical school or in the nursing. So the hospital and the university they are disconnected, and I believe because the growth and the demand and also the technology in the hospital, it is too fast comparing with the improvement in the education system. So this partnership something is required in
Yeah,
order.
and I think it depends, right? Like where you're at. I've seen some really strong partnerships, and those are your students that are going to go thrive in the hospital because there's such a strong partnership. Where I used to work as an educator, we actually would send out a survey to all of the surrounding hospitals that got our new grads of what are you seeing with our new grads? What are you thinking we need to work on? And that collaboration was helpful. But when that collaboration happens, a lot of times it's where you have your clinical sites placed. So, for example, let's say I work at school X, they're going to have clinical sites at probably all the major healthcare systems in the area. When that relationship is strong, your chance of getting a job offer post graduation is higher because they know how they educate you as a nurse. And that hospital or university is way more likely to say, hey, I trust how this university educated you. I'm going to bring you on right away. Where some schools get, not as strong as a reputation, it's harder for those individuals sometimes to go find that dream job that they're after.
Absolutely. So I believe now is a good time to hear from you, uh, as one work with the international student, how the new regulation and de-evaluation for nurses right now, it might impact the one who want to come here, and if there is any side effect or not. So let us understand from your perspective. If I'm not a student, I am graduated,
Mhm.
and I am not in the US at all. Is this will impact my career, my future, even if I don't have any plan to come to the US? Do you see this is from different angle? For me today, I speak about it, and I will not share with you my feedback right now because I don't want to influence you. But
Mhm.
I have a view. This is my impact, even is for non American, the industry overall. This is the way
Mhm.
how will impact, and I put my assumption. So from your perspective, do you believe this is will affect non-American, or this is no only for the student?
I think it can impact anyone if they don't have strong clinical. If you don't have a strong relationship between where you go to school and true clinical sites, yes, it could impact any student from anywhere, not just US based. My reason for saying that is the only way that you can train for real world nursing is to be in real world nursing. As much as simulations and VR can help and assist with that, it does not replace real world scenario when it's happening and you have to think on the fly and you have to think critically. I think, education systems do a great job with simulation and doing all of these virtual reality things. But if we're not in the hospital systems, if there's not collaboration between a university and a hospital system, it's hard to strengthen the nursing profession, no matter where you're from. Did that answer your question?
It does, yeah, straightforward for the
Yeah, it was pretty to the point because you need the hands-on experience. You have to understand, how do I talk to someone when they're on their deathbed and they're going to die in the next 48 hours? And then how do I communicate with that family? Or, hey, I'm taking care of a kiddo and they're in the NICU and their parent had did a bunch of drugs while they were pregnant, and now the parent's in visiting their baby that's in the NICU. How do I communicate in this situation? Like, there are challenging times where you're trying to figure out ethically, how do I communicate here? How do I best support not just my patient, but then you've got a family that you're also communicating with. And I think if you don't ever see that and you're not the person responsible for that in school, it's really challenging then to just be all of a sudden responsible for it in practice.
yeah, totally agree. So how you, if I want to close up with this, how you picture or imagine the future of nursing education?
Mhm. I think the more that we intertwine the hospitals with how we're educating, the better we're going to do. The more structured, and it can't just be, hey, here's your clinical site, go have fun for the day. It's me as the educator making sure, hey, have you put in a Foley before? Have you put in an IV catheter? Have you had someone on a drip before? It's me ensuring that these students are getting the real world experience to be ready for practice. And if they haven't gotten an experience yet that they need, I need to go help facilitate finding that experience for them because they maybe don't know how to do that. One thing I always tell my students is like, hey, make sure when you are doing clinical that you very openly tell everyone on the unit, I need these experiences. If you have something happening, come get me and I'll pull and come to this other nurse and at least watch if you can't participate. Nurses are usually very, very willing to assist. So if I think of the future of nursing education, that is intertwined throughout, so that we're making sure that our graduate nurses they're hitting all of these check boxes of like, these are the skills, these are the necessary things that you have to complete by graduation, and we're making sure that they've completed that. It's really bridging that gap between what they're learning in the classroom and what they actually need to apply in the hospital setting. It's making sure that how we educate is filling where they have that application piece. It's not just them memorizing a bunch of content because that's not going to take them very far.
It is, yes. And one thing today, it is for the first time I know this information. The drop off rate of nursing program in the US between 15 to 20%. And in Australia and Canada here, it's where it's shocked for me. I shocked 50% of the student they drop off their program. So
Wow. So that is tied in the US to be an accredited school by an accrediting body. You cannot have too many students drop out or fail or not make it to the end. You also have to have a certain NCLEX pass rate. And so there's a state board of nursing and an accrediting body. You have to be in good standing with both of them in order to even have a nursing program in the US.
but why? Okay, this is something is good to maintain the quality of the education, but working for you have education master and you have intensive experience working with the different nurses. How you see it from your perspective? Why nurses they drop off their program?
I think there's several reasons. Number one, they don't know how to deal with stress, I think is one of the top ones. Nursing school, compared to pretty much any other program out there, is super stressful. And when you go from pre nursing to nursing and you're not ready for that transition, it is overwhelming. The other thing that I would say that I'm seeing more and more of in students is students don't necessarily want to take the hard route. They want, give me that information as quick as I can, exactly what I need, and I'll learn that information. They're willing to do that. But that's different than how a lot of our nurse educators teach. I want students to be able to go find that information. I want them to understand how to do evidence based research. I want them to be able to critically think. And if I just give them all the facts, they won't be able to gain that skill. And I think that causes a few of them to drop out. Not saying everyone fits in that bucket, but I do think there is a significant number of, hey, I don't want to do this. The other thing that I think about is, what nurses do in the pay. When I think of new nurses, like when I graduated, I made more as a waitress through college than I did as a 4-year educated nurse, working nights and then charging. Like I made more waitressing tables. That baffles my mind the more and more I think about it, of like, we have to make sure that these individuals are paid adequately for their experience. And unfortunately, in healthcare, when I think of even CNAs and nurses, they're not always paid for that. And it's state by state basis. You have some states that pay nurses amazing. You have others, like where I graduated in Missouri, that you didn't get paid very much as a nurse. And so I think some people have this realization of, I'm going to put in this amount of work, but this is going to be the result at the end. Is that truly what I want to do? And then I think you have a camp of people that don't feel supported. They don't feel like they have the encouragement they need, and they're not able to be successful because of that. And so I think those are kind of the big buckets that it falls under. Not that everyone falls in those situations, but I do think that's why a lot of them are leaving programs while they're in them.
So what is your last advice for any student who are thinking to drop or not to drop and to pursue with their study?
Yeah, I think number one, go back to your why. Why do you want this? Like, is there a true passion there? When I think of myself, like I had a true passion to be an educator, I had a true passion. I wanted to be a nurse. The thing I never did though, I never scoped what a nurse was paid. I had no idea. I never scoped, hey, I'm going to spend X amount of dollars. How long is that going to take me to pay off my tuition with what I end up with? And so, what I recommend to anyone just going to college, and I've mentored so many people in this, whatever you decide you want to do, go about, this is where I want to go to school. This is going to be the cost. This is what I would graduate as. And this is the average pay for that career field. Is it reasonable for me to make that commitment and know that, hey, it's going to pay off in the long run? Sometimes people find that they're going to schools that are 70, 80 grand a year, and they're going to get a job that's paying them 40 grand a year. And it's like, is that a reasonable? And I'm saying thousand, and I just realized Canada totally doesn't convert to what I just said, but you get the gist of what I'm saying. Is it reasonable for me to spend that amount on my college degree, knowing that I may not be able to pay that off for a really long time because my career I'm going into doesn't pay that? But I think when it comes to nursing is, what is your why? Why did you choose to be a nurse? Why do you want to be a nurse? And let that why motivate you. And if you're to the point of dropping, ask why. Is it something that can be changed? Is it something in your control? Is it something out of your control? Or do you just truly not want it anymore? Some people find they just don't want to be a nurse, and that's okay. There's nothing wrong with that. But if you truly want to be a nurse, there is something that can be changed to help you get there. Maybe you need to find a mentor. Maybe you need more academic support. Find someone willing to do that so that you can be successful. Because if it was easy, it wouldn't necessarily be worth it. And I think sometimes we confuse that, hey, this is hard, so it's not the right path. Most of the time, the hardest journeys I've been through have led me to the best outcomes. And so I think we have to remember that it's hard because it's worth it.
Absolutely. And something here I want to add for that. I totally agree with what you are mentioning, but we have the stereotype for nursing. Nurses, they need to work on the hospital and they need to be in the bedside. No, this is not the right. You can work in the hospital, but not necessarily in the bedside. You can work on the software company, software development, working in media, working on the right now they can work everywhere. For I am one from those where I found nursing is not my cup of tea. So without nursing knowledge, I will not be who I am right now. So nursing, it's the foundation where you want to do or to go anywhere will help you. So this is the like ingredient. You can take this ingredient and make from them different recipe. It's up to you. It's not only bedside. Yeah.
Totally agree. It is definitely not fixed. The number of nurses I know that have started their own business is phenomenal. And it's not always in something nursing. I think it's that nurses, we have that critical thinking skill. We have this desire for more. Like that's a lot of us nurses. And they're amazing business professionals. Every time I feel like I see a nurse starting a new business, it's like, wow, this is a genius idea. And nurses just are comfortable being uncomfortable. And I think it makes us more willing to try different things. But you're right. Nursing is not just at the bedside. There are countless opportunities for nurses out there. And if there's not something someone wants, go create what you're looking for.
Absolutely right. Thank you, Rachel, for your time. Really learn a lot from you and your experience, and keep up the good work. And thank you for all your advice you have shared and share with you with us your perspective. And we learn a lot about the nursing overall and see the international experience, how they enrich the U.S. workforce system and also Canadian as well. Looking forward to have you again in person. Thank you. Bye-bye.
Bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Certiat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Certiat.